Hi, my name is Brooke Nolen, and today I'm going to take a few moments to explain to you about evidence-based practice, which is taught in the Nursing 300 course titled Transition into Baccalaureate Nursing at the University of Mount Olive RN to BSN degree program. This video is an assignment for my Master's of Science in Nursing degree at the University of Mount Olive. I have 4 goals and objectives for this brief lecture, and they include being able to define what evidence-based practice is, how evidence-based practice project is conducted, how it affects nurses and their patients, and how they can use these projects to grow within their organization. Evidence-based practice is very important for nursing. Nursing is an ever-changing and ever-evolving career, and through evidence-based practice, we can ensure patients are receiving the highest quality care possible. Evidence-based practice is based upon external evidence, individual clinical expertise, and patient values and expectations. Evidence-based practice is defined as the conscientious use of current best evidence in making decisions about client care. Additionally, evidence-based practice models gather evidence from relevant issues within one's practice, conduct a study in which a change occurs, and implement a practice change if deemed appropriate based on feedback. Evidence-based practice allows nurses to create changes in patient care through their everyday practice and problems they face firsthand. There are 5 basic steps for an evidence-based practice project. These 5 steps include 5 A's: ask, acquire, appraise, apply, and assess. Nurses must find an issue within their practice, ask a question about the problem, search for a solution or a change, gather data to evaluate the need for this change and determine if it is necessary, incorporate the change in their practice, and then evaluate the outcome. There are several advantages to evidence-based practice projects for nurses, including improved patient care, better use of the nurse's time and workplace, and provide the nurse an opportunity to expand their career through an active role and contributions to the science of nursing. Additionally, many employers require an evidence-based practice project to be conducted in order to climb the clinical ladder and grow within one's role as a nurse. These projects can be as simple or as complex as one chooses them to be. Examples of evidence-based projects include methods to improve infection control practices, recognizing alarm fatigue, more effective method to review discharge instructions with the patient, or ensuring staff correctly label and the expiration dates on strip and quality control vials for glucometers. This brief lecture has reviewed defining what evidence-based practice is, how it is utilized in healthcare, how it affects us as nurses and our patients, and how it can be utilized in practice. This information was supported by evidence found through text and internet resources. Thank you for your time and attention today. Please complete the short survey provided through the Nursing Student Center and email it to my professor, Dr. Joy Kiefer, at jkiefer@umo.edu within the next 3 days. Thank you.